Hello, everyone, and welcome to day 2 of the National Children's Campaign's Convention Week events. Today, we are focusing on school reopenings. Again, my name is Jonah Gottlieb. It's great to see you all again for those who attended yesterday's event on the U.S. Department of Children and Families. Thank you all so much for being here, and we've got a great event for you all. Before we begin, I'd just like to do a few quick housekeeping things. First of all, we have an exciting new event that we're doing this Wednesday and Thursday. So we are doing a Twitter storm during Kamala Harris and Joe Biden's speeches, making sure that they are making America's children a national priority. So please join us, Every Child Matters, and Zero Hour in making sure that they know exactly where the American people stand on children's issues. So you can use the hashtags #VoteForKids and #VoteForOurFuture and tag those three organizations, as well as Vice President Biden and Senator Harris. So that's Wednesday night and Thursday night this week. We also, of course, have Vote for Our Future merch. So if you want to check that out, here's some cool stuff on the screen right now. And so if you would like to be a part of that and get your hands on some merch, you can go to voteforourfuture.org/merch and get all that stuff. And of course, we want everyone to be registering to vote, and we want everyone to be voting on behalf of America's children. So whether you're a youth or an adult, you can still have a voice in this election. And so please register to vote at voteforourfuture.org/vote if you are eligible to vote. And if you're a young person, make sure that the adults in your life know where you stand on the issues and are voting with you in mind. And lastly, we have events every single day this week, Wednesday, Thursday, Friday at 4:30 p.m. Eastern, 1:30 Pacific. And if you want to check those out, you can find the links to all those at voteforourfuture.org/convention. And so, yeah, that's kind of all the housekeeping stuff. If you want to get involved with anything that the National Children's Campaign is doing, you can email us at info@nationalchildrenscampaign.org. Or you can DM us on Instagram, Twitter, Facebook. You can check us out on YouTube, on Twitch, on LinkedIn. Please get involved. Please reach out to us. We want to bring you in as part of our movement. And so without further ado, I am going to hand it off for our moderator for today's event and one of our amazing youth organizers with the National Children's Campaign, Isabel Britton. Isabel, take it away.
Good afternoon, everyone, and thank you so much for joining us today. My name is Isabel Britton, and I'm a 16-year-old activist and organizer with the National Children's Campaign from Great Falls, Virginia, and I will be moderating today's event. For those of you who are unfamiliar with our organization, the National Children's Campaign is a nonprofit fighting to ensure that America's 74 million children are made a national priority. The NCC ensures that adults, whether they are voters or elected officials, are fighting for the children. As Jonah mentioned, this week being the Democratic Convention, NCC has launched a week of action with discussions and panels focused on why we need a president who is fighting for children. Today, we are joined by 4 amazing professionals to discuss the impact of schools reopening during the COVID-19 pandemic. Here with me today is Mara Bolis, the Associate Director of Gender Justice and Inclusion of the Inclusion Hub at Oxfam America, Devin Del Palacio, the Chairman of the Black Council for the National School Board Association, the Chair of the Black Caucus of the Arizona School Board Association, and Vice President of the NAACP for the Arizona chapter. We also have Dr. Nancy Pipe, an Associate Professor at the UCLA School of Nursing and lead faculty in the Pediatric Advanced Practice Nursing Program. He is also a practicing pediatric nurse practitioner in cardiac surgery at the Children's Hospital in Los Angeles. And finally, we have Dr. Dione Mills, an OBGYN hospitalist serving in Phoenix, Arizona, as well as a public education advocate. Thank you all so much for joining me today, and we are so excited to talk with you today about schools reopening, especially during the COVID-19 pandemic, and the impact that this will have on children and families. If any of you would like to go around and add anything else before we get started, now would be the time to do so. But if not, we can jump into questions. Okay, diving into our first question. Already, there have been schools across the country opening up, and different districts have unveiled their own individual plans for the upcoming school year. Recently, a picture from a school in Paulding County in the state of Georgia, which returned to in-person learning earlier this month, went viral online after a student posted it. The picture showed students packed together in a crowded hallway. For our first question, which is directed to both Dr. Mills and Dr. Pike, from a medical standpoint, is the United States ready for students to be sent back to schools? And what are the possible ramifications of youth being put in this setting? If Dr. Pike would like to start us off, and then we can transition to Dr. Mills.
Hi, thank you so much. Thank you for being here today. Definitely that school district and everything varies depending on your state, your community prevalence, the size of your school, and things like that can definitely impact the spread of COVID and the ability of your school to properly screen, monitor symptoms, and abide by the CDC guidelines that are out there for preventing or mitigating the transmission of the virus. This school that you did mention in Georgia, face masks were not mandatory for that school. So I think that played a key part in why we're seeing what we're seeing. And it's not just in that school. We're seeing more and more COVID cases coming out in children than we have before. This virus we're constantly learning about. We're learning about its transmission rates. We're learning also about its seasonal patterns, which we don't know about as well, too, that we're learning about. So things are constantly changing, and our thoughts that children were not as at risk are now new information, and research is coming out in light showing us that children are obtaining or being able to contract COVID and transmitting it at the same rates as adults would. Our real biggest concern out there is the safety for children going back to school, not just the children, but also faculty and staff. And we worry about also the children and staff that are what we call medically vulnerable, meaning that they're over the age of 50. 1 in 3 teachers or 1 in 4 teachers are over the age of 50. And many of them have a medically vulnerable either spouse or child or parent at home that they worry about transmitting that virus to. So we have to really be cognizant of these things, the school's ability to be able to follow guidelines. Many of the school districts use combinations of sharing school nurses. You need a champion in every school that's going to be your COVID coordinator and be able to respond and have an action plan for if somebody develops symptoms during school time. So I think there's definitely, it varies on whether we're really ready or not, but by the looks of things, with camps and with schools and things like that, we're definitely seeing an increase in the rate of children contracting this. So yes, we're concerned, and we have to really have some good plans in place for schools and colleges so that we can all be safe in this process. And compliance is really the key issue here.
Dr. Mills, if you'd like to add anything, I know going back to school should really be focused on the science of things and how things are looking just from a medical standpoint. So would you like to add anything to Dr. Pike's answer?
Yeah, just to, echo what she's saying. I mean, every state and every state has their own situation. Every state has its own positivity rate and its own rate of transmission, its own community spread. However, in general, even states that are at a positivity rate that would allow them to try opening, they have to be very careful. And we have to look at it as a statewide thing. We can't look at it just as a county issue or a zip code issue, because the virus doesn't care about zip code lines. So we have to make sure that states that do open with caution, and adhere to strict guidelines as far as wearing masks for teachers, staff, and children, adhere to social distancing rules and everything like that, or else they're going to end up spiking in their cases. So if we have to decide, is a school able to reopen, it's not just about that school, it's about that state and about the resources that those teachers and staff have been given in order to be safe, so that they can keep the positivity rate low once the schools are reopened.
Thank you both so much for your input and for your professional advice. This is definitely a challenging time for schools across the country because, just to echo what Dr. Mills was saying, this pandemic has really showed that the virus doesn't care about borders or what state you're in. But regardless of what action plans schools are taking, whether they're returning fully in person with a hybrid model or are returning to fully digital learning, there are challenges that come with basically every plan. So while in-person learning presents its own set of challenges, students doing classes at home through online platforms like Zoom comes with its own set of issues, such as access to technology, Wi-Fi, as well as parents working. So for this question, Devin, does remote learning put some students at a disadvantage, and how should this be combated so that learning is equal and fair?
Thank you for that question, Isabel. Well, I'll first start off by saying this. The best way for our students to learn is in person, right? So I'm going to go ahead and just make that very clear right now. The best way for our students to learn is in person. And our teachers know this. Our district leaders know this. As board members, we know this. But during a pandemic, the compromise and the safest way to ensure that they still get access to some sort of education content is to do it virtually. And we know that there are inequities that exist when we're doing this virtually, but it is the safest way forward for now until we're able to get COVID down to a level to where it's safe to return to in person. So yes, there are inequities. And one way we can ensure that our most vulnerable students still receive the support services they need is to be able to contract with third-party vendors and really try to meet the needs of the most vulnerable students. I'm talking students with special needs, students who are second language learners, and so on. We also got to look at ensuring that wraparound services are still provided. So we know that sometimes meals, right, access to meals for some students only happens when they come to school. So as governing board leaders and education leaders, we have to ensure that we're still providing access to these basic necessities, food, education content. And so, for example, in our district, we are delivering 5-day meal packs. So we're actually delivering meal packs to our most vulnerable students. So any student who's on free and reduced lunch, right, they qualify to get these 5-day meal packs, and we actually drop them off directly at their house so that parents don't have to leave, the students don't have to leave. And so there are many different innovative ways we can try to meet the most vulnerable needs of our students, but it's going to take courage, and it's going to take a little bit of leadership. Unfortunately, nationally, and even in some cases locally, we haven't seen much leadership. We haven't had much guidance and leadership at the top, which has left a lot of school districts and governing board members with a lot of tough decisions to make. But again, online right now is the safest way to deliver education. And I'll go ahead and say this. We have to be careful to not demonize technology. Technology is not going anywhere. It's only going to enhance, right? It's only going to advance as we move forward into the future. So let's not demonize technology. Let's figure out a way to leverage it properly. Let's figure out a way to make it work for students and families. Let's ensure that folks in our rural communities have access to data. Let's ensure that our students who have working parents can still get that personalized tutoring whenever they need it. We got to meet folks. We got to meet our students and families where they are.
Thank you so much for your answer. And I 100% agree. I will, of course, every student wishes they could be going back to school in person right now with the state of the pandemic and how things are. It's just simply not safe for most students. But now kind of bouncing off that, Mara, as the Associate Director of Gender Justice and Inclusion Hub at Oxfam America, how will having students at home and doing school digitally from home impact mothers disproportionately?
Thank you so much for that question, and thank you so much for having me today. And Devin, I couldn't agree with your statements more. So we've done some research with the Institute for Women's Policy Research and with Promundo, both pre-COVID and post-COVID. And pre-COVID, we saw that women did 2 hours more care work per day than men in the United States. And post-COVID, we saw that the majority of women that we surveyed felt that their care work, so care work is everything that's done in the home, caring for children, cooking, cleaning. And so post-COVID, as you can imagine, that's gone up dramatically for all women, right? It's gone up for men too, but it's not gone up to overcome the inequality that exists at home. And it's gone up disproportionately for women of color, right? My fear is that a lot of school reopening plans are focusing on kind of a single privilege narrative where we assume that either people can work from home so that they can navigate, so that the carers can navigate this trajectory for their children, which is not necessarily the case, right? We've seen kind of the racial disparities in terms of who can work from home and who can't, or that there's one parent that's going to just manage it. And we've seen other research that says, get this, women are 10 times as likely to stay home when a child is sick. Mothers are 10 times as likely to stay home when a child is sick than the father, 10 times as likely. So we already know from National Women's Law Center that just in April alone, an entire decade worth of women's job gains were erased. 1 month of this pandemic. So in my mind, this is going to be devastating. It's devastating for all of us that are parents of school-age children. But what I cannot get out of my head is how you navigate this if you are a single mom without workplace flexibility. I just don't understand. And if policymakers are continuing to develop policy around one very privileged narrative, we are completely leaving behind our most vulnerable carers and their children, and it's unacceptable.
Thank you so much for that answer. And yeah, I think a lot of people at the beginning were thinking that, oh, a pandemic is the ultimate playing field. But if anything, it's just shown us more the total inequalities and issues that were already present in our society that were just being ignored. And if anything, COVID has really just exposed them and really shed a light on all the different issues that American society has. And yes, Dr. Pike, were you wanting to add something in?
No, I just wanted to echo what Mara was just mentioning about, we're definitely seeing those disparities and that privilege narrative in that many teachers that may not want to go back to work, that are being asked to go back to work, are resigning or leaving and being hired out in pandemic pods or teaching pods, as a way to, earn money and support their family. But that's removing teachers out of the public school system. And some states definitely have limited teachers and resources in that area. So with this shift of private teaching to folks that have the means or ability to do so is further creating segregation amongst our children in the schools and their future opportunities.
Yeah, definitely. And something that Dr. Pike brought up that I really want to go off of is that it's not just the children who are really being forced back into school, but it's also these teachers. So Devin, with your extensive background in education, if teachers or staff who choose not to come back to school because they fear putting themselves or family members at risk end up getting fired or lose their health insurance and or their salary, what long and short-term impacts could this have?
Well, I'll start off by saying this. I had a conversation with a teacher a few weeks ago who said this: I'm dying to go back to work, but I don't want to die because I went back to work. Okay. She said, I'm dying to go back to work, but I don't want to die because I went back to work. And that struck me. Look, our teachers want to be in the classroom. They want to educate our kids. That's why they got into this business. I mean, teachers are that's one of the most underpaid professions in our nation. They know what they got themselves into, and they're extremely passionate about their work. And they would like nothing more but to be back in their classroom with their kids. But the fact is, I personally think it is unfair to force folks to come back. I think it should be a choice. And it should only be a choice when schools have the necessary resources to do it in a safe way. And that means PPE. That means ventilation procedures. Sanitizing processes, etc. So if we're going to ask teachers to come back, we need to make sure that there's resources in place to protect them. But no school district, I don't care where you're at, can give 100% guarantee that their staff is going to be safe when they return. And I think that's pretty scary, right? But to your question, what are the long-term effects of this pandemic on our educators who are leaving the profession? As Dr. Pike mentioned, look, in Arizona, we're already in a teacher shortage, a teacher crisis, and it's hard enough finding substitutes. So imagine doing that during a pandemic. So what this does is creates a vacuum effect of not having certified teachers in classrooms. This creates a vacuum effect of students getting pulled out of public school districts and maybe moving towards private schools or even charter schools. And so which hurts public education as a whole. And because it's all related to funding, right? If public schools lose kids, we lose funding. And that just depends on which state you're in, but that's typically the case. But again, I think this is a very, very difficult situation. Each school district is making their own decision on whether staff come back or not based on local control. And so you have some districts that allow it, some districts that don't, which is also creating inequities, right? So now you have some schools with teachers who have certified educators, and you have some schools that don't have a certified professional in that room. And that's not equitable, right, for our kids. And it's typically in the neighborhoods of our most vulnerable students. And so very, very tough, but I really do have an issue with firing staff and cutting off their benefits and putting them out on the street if they don't feel safe enough to come to work. I really have a problem with that.
Dr. Pike, did you want to add something there? And of course, Dr. Mills, you as well.
Well, I was going to say that, as a frontline worker, we are considered an essential worker. Now, one of the arguments that we've heard throughout this whole year is that, the teachers are essential workers as well because the kids need to be in school, so therefore they have no choice, they should go in. But people who make that argument also leave out the tiny detail that essential workers are supposed to be armed with appropriate PPE. Just because I'm an essential worker and I have no choice but to go into a room with a patient who is COVID positive on a ventilator does not mean that means I walk in there with nothing on my face, no protection on my eyes, no gowns, nothing like that. The two have to go together. Essential worker doesn't mean sacrificial worker. And what we're seeing in the schools is that teachers who are being pushed to go back to school are also being pushed to go back without their equipment. They're going back without proper, gown, without proper eyewear, without proper protection. Teachers who have special needs kids or kids with sensory deficits that cannot wear a mask, they can't just go to work with a cloth mask or bandana. They have to be given things like KN95 masks and N95 masks that they can wear so that they can be actually protected from the virus, because their kids cannot necessarily wear masks. But yet a lot of the schools seem to forget that not so minor detail. So if we want our teachers to feel safe going back to work, we also have to give them the resources that they need so that they can actually feel safe and be safe going back to work. But the problem is that they don't have that. A lot of them are buying supplies out of their own pocket. I did that. I've spent hundreds of dollars on my own protection because, as you know, there was a PPE issue, and there is still a PPE issue in medicine right now. But teachers shouldn't have to be, no one really should be having to provide the proper safety equipment for their job, because I feel like that's an OSHA issue that's not being addressed right now. But, you know, if they have to provide masks out of pocket, and we know that there's a shortage of actual proper masks in this country, then we're asking them to walk into the burning building without their equipment, which makes no sense. So it's logical for them, just as it was logical for us in medicine to say, if I don't have what I need, I can't go in there. So it's a villainizing of teachers for just simply having common sense. And it doesn't mean that they don't love what they do. I love what I do, but I was willing in March to leave if I wasn't going to have what I needed, because all I needed to do was get sick once, and I would never save any other lives ever again. And as much as I wanted to be a physician, I wasn't going to sacrifice that because I was not in a safe environment. And it's the same thing for teachers. So this is not about them not wanting to do their jobs. This is about wanting to be safe in their jobs. So if we want our teachers to go back to work, when we want our schools to open, we need to prove it by mandating masks in our states, mandating social distancing rules, mandating businesses that should be closed because they're high spread areas, giving the teachers what they need to be safe in the schools. If they can show that that's a priority for them, then I think that we could actually, you know, move in the right direction.
Thank you. Yeah, I think the first thing we saw was that doctors were completely unprepared, and now heading into it, we're seeing that teachers are in the same place and unprepared. So going over to Mara, I know earlier you mentioned how a lot of women, this was disproportionately impacting women, especially stay-at-home moms, but for women who are teachers, especially who face the problem of maybe if they are faced with this impossible decision of going back to school unprepared and feel like they can't go back, what long-term ramifications would this have?
This is bananas. I mean, to add to what Dr. Mills just said, they need equipment, but so my children are in middle school, entering high school. I've had the privilege of having a lot of really caring, wonderful, warm relationships with their teachers over the years, many of whom had small children, and many of whom don't necessarily live in the school district where they teach. Some of them do, but some of them don't. And the plans for going back to school are all over the place. I mean, a town next door has a completely different plan to our town. So not only do they need the equipment, it's like the Maslow's hierarchy of needs or something, like how many bricks are in the bottom layer. And I think the bottom layer, it begins with the equipment, but there's an extension to that that's the care infrastructure. How are these teachers, if they have young children, how are they expected to make the decision of whether or not they go back to school or care for their school-age children if the kids are on a different schedule than they're on? We didn't design to, in my view, we need to care for our children, we need to care for our carers. And the centrality of the teachers, the carers, we've not made policy around the teachers and the carers because we've taken them for granted. And now with COVID, we've seen, oh, actually, without that, everything stops. Without support for our carers, everything stops. Nothing can work. The economy can't function. Schools can't function. So I'm hoping that this provides a reorientation around I don't want to say essential workers because it's so overused, but refocusing really our policy on who and what is important for all of our children. Yeah.
And may I add something real briefly? In Arizona, there was a school district who had several teachers who were teaching virtually during the summer. They had masks, face masks, they social distance, etc. Still contracted the virus, and one passed away. So even when you're following the rules in a typical school setting, there's still a risk. We've lost several teachers and educators here in Arizona. And again, I would, as a policymaker, it's simple. If I can do something to prevent it, if I can put a policy in place to prevent it, then why not do that? Why not take that step? Why take the risk? Why play Russian roulette with our kids and our staff? It isn't worth it. Let's look at best practices. Let's look at what other nations are doing and implement those. We got to lose our ego, right? Like we got to lose that. Because at this point, the priority should be, how do we save lives? You know, there's no 100% expert on this disease, on this virus. No one knows all there is about this virus, but what we do know is it is taking out our most vulnerable, right? It's hitting communities of color hard, right? And again, so I would hope that our policymakers, and again, I bring this back to political will, because unfortunately, saving lives has become political, and it shouldn't. I've always said there's two things that shouldn't be political, and that's access to education and healthcare. Those are two things we shouldn't debate. Everyone should agree on those two issues, right? And unfortunately, we're sitting here now, mid-pandemic, in a crisis, and the entire world is looking at us with dismay.
Thank you so much for adding that in, Devin. I completely agree. This pandemic has become so heavily politicized in a time where it should be about everyone coming together, and just echoing what you said, the importance of teachers really to help children thrive in schools. But so like we've been talking about is all the risks that come with going back to school. But the topic still that seems to be on many Americans' minds is what's the best way to move forward, and how do we really get our children so that they're learning but also safe. And especially with the school year approaching fast, parents and students are itching to get back to normal with learning, but at the same time, states are experiencing an increase in cases. So looking at the risks that COVID-19 poses to students, teachers, and school staff, in your opinion, starting with Dr. Pike, what is the best plan of action for schools for the upcoming school year?
I'm going to just kind of go out there and say that we actually do not know with what's going to happen in the winter months with this virus. This is really going to be something that all our infectious disease doctors are going to be really monitoring, and our public health departments are really going to be watching what happens as influenza starts this year, and also looking at the increase in the cases of COVID during the winter months as well too. I think for the safety of everybody, until we know more, or until January, when we hope that a vaccine or some antiviral medications may be available. And it's important to know, just because a vaccine becomes available, that doesn't mean that it's going to eradicate this virus. Respiratory viruses are very difficult to contain. Even the influenza vaccine has a 50 to 70% chance of it being effective. So that means 20 or 30% of people will still get influenza, even though they had the vaccine. And the same thing could happen with this vaccine as well, too. And then the high number of families that choose not to vaccinate has to be weighed into that equation as well, too. So even though a vaccine is out there, there's going to be a certain amount of the population that that will either choose not to take it or will take it and still get it. So with all of these unknowns that are out there, I agree with what Devin had spoke about before, and that's definitely everything should definitely be remote or online learning at this point, just to really protect our teachers and to protect our students and families. And like Dr. Mills had mentioned before, you wouldn't ask a physician or a nurse practitioner to go into a patient's room that or potentially may have COVID without proper protection. So why would we ask our teachers to do something differently? So it has to be policies in place for everybody to follow as a whole. And as I said before, compliance is definitely the key. And to think that you can't get it or you're not going to be affected by it and I'm not going to walk around and wear a mask, those are things that we really have to try and educate people as much as possible, show the literature that's out there that supports wearing masks and reducing the spread of this virus. So long story short, I really am supporting online education at this point for fall and potentially through till winter. And then we're going to have to reassess this as things go and look at our prevalence by state, communities, and just see what happens. And then hopefully there will be new treatment or preventative options that become available that we can start implementing in our communities.
Yeah, 100%. With COVID, we really just don't, it's something that we don't know the full future of. But Dr. Mills, looking at things from just the medical standpoint, do you have anything to add when looking at the health of our children, teachers, and all school staff about the best way that we can really move forward with opening up schools?
Well, what us in the medical community is saying is not that we're saying that we want schools to be closed indefinitely. We're not saying that we've given up on the experiment of education and we just want to shut things down because we're afraid and we want to just close our houses and close our windows and just close up. What we're saying is that we need time to collect more data. It's not necessarily acceptable to say, as Devin kind of alluded to say that we're willing to do a Russian roulette and we're willing to experiment on the lives of our teachers and our students while we figure this out. We don't necessarily need 100% perfect knowledge of this virus before we open, but we definitely need more information than we have right now with the inflammatory syndromes that we're seeing in children that is affecting all of their organs. We are seeing pregnant women with poor effects as well. We're seeing a lot of things come down and people who've recovered from COVID having long-lasting organ issues that we are continuing to catalog on a daily basis. We need more time. And then we also need more resources. But it all comes back to a resetting of priorities in our country. We need to get back to science as being a thing. We need to get back to facts as being different from opinion. We need to get back to leaders who are willing to go with the science as opposed to trusting their lack of knowledge and thinking that they're entitled to an opinion about something that they don't have any knowledge about. We need those things. And it sounds like, well, we're not going to get that stuff, but that's what we need. We cannot change the trajectory of this without those things as much as we want to. And we need to remember that based on the science, America needs a nationwide policy for managing this virus. It is a true testament to the lack of understanding of viruses when any leader says, well, you know, Wyoming's different than Idaho, and, you know, the district, Maricopa County in Arizona is different than Pima County. No, it's not. The virus doesn't know about that. The virus never got that memo. So we have to remember that there are certain things that are true regardless of what state you live in and what country you live in. And so those things have to be put in the proper category of, regardless of where we are, what we're doing, socioeconomic status, this is true about the virus. We need to treat that as a universal thing. And then another category for things that can be tailored toward our states. But while we are getting that knowledge about and putting that to the forefront, based on that knowledge, we need to get more resources for things that Mara so eloquently brought up. We know that even though medically I still stand, I'm a mother of 3 children and I'm a huge equity advocate. I know that it's more complicated than just you need to stay at home. It's not that easy for everybody. And it is a true privilege when you're able to work from home, or you're able to have your children at home because you have a stay-at-home spouse or something else. At the same time, medically, I cannot change my recommendation. And that makes me that stresses me out sometimes, because I wish I could tailor my recommendation to the fact that you're a single mom or you don't have internet at home. But the virus doesn't care about those things. That is still going to be my recommendation, regardless of what those other situations are. So let's acknowledge those things and give those people the resources that they need so that they can follow the science without huge detrimental effects to their finances, to their safety, to their mental health. We have the ability to address those things on the other end without deciding, well, we're just going to ignore how a virus works because we don't want to have our grocery store not staffed. We have to be able to really figure out what our priorities are, and we can actually still address all of those valid issues while following the science, if we as a nation are willing to actually put our resources where they need to be and get those supports in place. If we can do that, then we can stay safe, we can support our workers, we can support our people with no technology or with unsafe home environments or with one family member in the home. We can support our vulnerable populations, and we can follow the science and do what we need to do. And maybe that's very idealistic of me. I've never been accused of being idealistic, but it's possible. But the problem is we need the will of the people to make that happen. And we have the resources in America. We just have to have the priorities with which to allocate those resources. And that comes from leadership. That comes from understanding and respecting science. And until those things fall in line, unfortunately, we're going to be having the same conversation 6 months from now.
Yeah, I think you brought up a lot of really interesting points about the different situations that people are in all across the country. And it really highlights why the government needs to be giving financial support to the people and helping everyone as we try to navigate these difficult times. And something that you really brought up is how students will be at home and how parents will be in all different situations, which kind of segues into our next question, which is that while parents will be either working from home or trying to juggle working in person at a job, they're now going to be joined by their children at home for many of the kids across the country who will be doing school from home. So our next question is, what kind of support should parents whose kids are going to be at home and these parents are either working from home or are working in person, what kind of support can we give them and what kind of support do they need? And so I think we'll start with Mara on for women especially who are either working from home, living in these single parent households, or are going into work in person.
I just first want to start by saying how moved I am by this incredible panel of people and how privileged I feel and proud to have been on the stage with you all. So one thing I wanted to say before I start is this is all going to be an iterative process, right? We're going to get one set of solutions figured out, and then we're going to be in a completely different scenario. So I feel like everyone needs to be planning for everything all the time for so many different scenarios. It's really scary. And Dr. Mills, I feel like you are doing kind of the classic thing that many women do, which is you are doing your job and trying to figure out solutions that other people should have the responsibility of filling out. Like the leadership of our companies and of our government should be figuring those things out, while you are focused on the science and you are making your best recommendation focused on the science. So you are doing exactly what you need to be doing. And it's up to leadership to accommodate those scientific realities. And the leadership that I'm talking about is both public sector and private sector. So some things that we really need to do, well, okay. One more thing to say is that what we cannot do is require women to absorb the uncertainty on their own, and especially the invisible women who don't get written about every week in the Washington Post, who don't have access to platforms like these, who are being made to choose between leaving their children on their home alone on their home and going to work. So I think there's a piece of this that's around bolstering our childcare system, right? There are childcare institutions that are accepting helping children work through their remote school days. That's an option that has to come along with a dramatic bolstering of our childcare system, which is crumbling right now. And also subsidies for childcare subsidies for low-income working parents who really need that assistance for them to make this all work. There are great bills in front of Congress: the Child Care is Essential Act, Child Care for Economic Recovery Act. They should really be central to our economic rebuilding and part of the next recovery plans. We should be offering cash transfers, cash benefits for those carers who don't have the flexibility, who need to leave their jobs in order to manage this. So there should, I think, targeted transfers to those parents who don't have options in terms of flexibility. For those who do them, you look at private sector approaches. We need more workplace flexibility. We need paid family leave. So many, I don't have the numbers in front of me, and I wish I'd pulled them up. So many essential workers lack paid family leave, and the distribution, it crosses income lines. So the lower paid the worker, the less access to paid leave. The higher paid the essential worker, the more access to paid leave, right? That's something that's in our control as employees, right? That you can be providing before the government acts. Hopefully the government is going to act and is going to extend paid leave to all Americans. Until that happens, workplaces can both offer more flexibility so that parents can navigate this difficult balance, and they can signal that they want their employees to take it. It is one thing to offer it. So unfortunately, Promundo, a partner of ours, has done a lot of studies in terms of masculinities in care, and a lot of men don't take the leave, that even when it's afforded to them, because they're afraid that they're going to get penalized for doing so, that it's going to look like they're not committed, right? So employers needs to signal to men and women that they understand what we're going through, that this is untenable for parents, and that men and women should step in. And if men step in more, maybe we can patchwork our way through this, maybe. But we definitely need more leaning in from, not from the women anymore. The women have leaned in so much that they're doing cartwheels. They're like leaning in, and they can't lean in anymore. We need government institutions to lean in, and we need private sector actors to lean in. And we need to be keeping those most vulnerable in our focus.
Thank you so much for that answer, and really insightful that we really need to be focusing on those women whose stories aren't told, like you were saying, and that how the government can really support us. And so just bouncing over to Devin quickly, especially for the parents who will now be at home with their children, what about these subjects that are practically impossible for their parents to help teach? How can we really support parents who will now be taking on some roles of a teacher at home with their kids?
Well, look, I'll go ahead and tell you that I'm experiencing that myself right now as a parent. I was just helping out my daughter with her 4th grade math, and I figured out I now have a deficiency in that area. And so for a lot of parents, this is something completely new to them, right? Having to be the teacher, having to answer these difficult questions for their kid. And I can't imagine how parents feel when they don't have the answer for their children that are asking for help. And so the most important thing we can do is to communicate to our parents and also to our students is that, hey, it's okay. You're going to make mistakes. You're not going to get every answer correct. That's okay. We just need to be more flexible with each other and the situations that we're dealing with. Flexibility and empathy is the key. Flexibility and empathy. That should be the rule of thumb until we get this pandemic under controlled. Empathy and flexibility. Alex, I'll tell you what, a lot of what Mara said really hit a chord with me. My mom, who's a single parent, she had me at 16 years old. I have 3 younger sisters. One just graduated high school, one who's still in high school. Okay. She's a frontline worker. She does security for the light rail system here in Arizona. And she doesn't make a living wage. She has to work overtime. And she's just one paycheck away from being out on the street. And there's nothing I can do to help. And she plays by the rules, pays her taxes, busts her tail at work, does what she can she does everything she can do for my little sisters to ensure that they're in a good spot, but it's still not enough. And there are millions of women in that position, millions of Americans in that same position, and they're tired of it. Meanwhile, while the top 10% or top 10 billionaires in this country continue to get richer. You look at the companies that are doing well in the stock market, the Nikes of the world, the Amazon, they're all having record years. Meanwhile, while the hardworking Americans like my mom, who bust their butt working 60, 70 hours a week, who have kids at home, who, by the way, have to stay at home by themselves because my mom doesn't have any other choice. She can't afford daycare, has to figure it out the hard way. And I can't imagine the mental stress that she has to bear on her shoulders, right, to do the right thing. It's really unfortunate, but the subject that Mara shared with us and the untold stories of the many women who are holding it down for the families just aren't shared enough. So I wanted to share my own personal story with my mother. But again, the key word here is flexibility and empathy.
Thank you so much for sharing that, Devin. Did you want to add in, Dr. Pike?
Yeah, I just wanted to kind of piggyback on what Devin was saying, and we do have to shed the light on mental health during this time with our students, with our families, the stress that this is creating at home, and students at school as well too. The stress and anxiety of the unknown, of going back to class, and the devastation that this virus has plagued our community and our country as a whole. And we need to look at services that can support coping and resilience during this time. It's really crucial. And utilizing your school nurse or having access to the school psychologist may be valuable resources for families, as well as your medical providers as well too, whether you're doing a telehealth visit or an in-person visit. We already have a mental health crisis in our country currently, and this is just adding another layer that we need to be cognizant of in our schools and in our communities. And also, to add on a little bit on what Devin was saying, I think we need to also have some resources that are available within our schools to have virtual office hours to help parents with their kids doing homework. I do, in my academic position, have virtual office hours and bring students in at 15, 20-minute blocks if they're having a hard time or they don't understand a concept, or helping them figure things out, or having or developing small breakout rooms with a small group of students to maybe help them after hours. So we need to really be creative in what we can do to help support those families that are struggling being able to assist their child with their homework or other activities that they're doing.
Yeah, that's definitely something. Mental health is something that's very important to me, and I feel like it's been another one of the things that has really been exposed is the lack of mental health care that students already have, but right now really don't have access to, especially when they need it most during this COVID-19 pandemic. And something that all of you brought up, and especially Devin and Dr. Pike in those last remarks, are really the need for leadership right now and to help out Americans, because Americans are struggling and they're not asking for a lot. They're just asking for the ability to get by. And especially with the 2020 election coming up, it's more important now that we're electing elected officials, and especially a president that will think about the future of children. So as a final question for each of you, what does a president for kids look like to you? And why don't we start with Dr. Mills on this one?
I want a lot from a president for kids. I'll try to keep it brief. A president for kids is someone who truly lives like they value the sanctity of life, and it's not just a political slogan, but it's in how they live, how they act, what their thoughts are, what their actions are. We need a president for kids that values education and is willing to make sure that they lead the country in putting better resources and priorities and funding in public education, and bringing equity into the education system is important for our children. But being a president for kids means that you're going to advocate for the same things that adults need, right? We need a criminal justice system that's actually going to be equitable, so that we don't have as much of the school to prison pipeline. We need safe schools. We need mental health services and proper counseling in our schools. We need a proper complement of school nurses in our schools. We need all those things. A president for kids will believe in science and advocate for science, and advocate for advocating for keeping everyone safe. And so it's not just about this pandemic right now. We need somebody who is empathetic. As Devin said, we need somebody who knows how to be selfless, how to really inspire the rest of our society to be selfless and be empathetic and be understanding, and truly do the things that we need to do to keep everybody safe, not just our own comfort. Safety of the whole over the comfort of one or two people. And that, I think, will be a great president for
Thank you, Dr. Mills. And I really echo what you said. The children they're not only our future, but they're also our now. And we really need to be paying attention to what children will need in the future, but also what they need right now. So popping over to Mara, what does a president for kids look like to you?
So I really like what Devin said and what Dr. Mills also referred to. I think we need leadership that will model and enable empathy and flexibility within our institutions, within our workplaces, within our schools, within our healthcare system. I think we need a leader who's going to center our economic rebuilding around carers. And when I spoke about carers before, I neglected to include the carers who are on this call, Dr. Mills and Dr. Pike, who've been the healthcare workers that are so central to this recovery and who are so central to the health of our children and to our families. But we focus our economic rebuilding around those carers who make our economies and our societies healthy and functioning, and who will stay focused not on appeasing the most privileged, but who will shine a light on the experiences of our most vulnerable, and who will inspire, as someone who I respect very much said in a recent speech, will inspire our better angels in all of us to be focusing on the most vulnerable and building our pathway forward around their experience.
Thank you so much for adding that in. Dr. Pike, what does a president for kids look like to you?
I think in this webinar, we've talked about the two key issues, and that is health, children's health, and education really need to be prominent in the forefront in our presidential candidates. And we really need to have a good, solid plan in regards to education and to really ensure that no child's future is determined by their zip code, their parents' income, their race, or their disability that they may have. And we really need a plan that supports and invests in our public schools, as well as supports our teachers in improving teachers' pay, recruiting more diverse teachers, and also ways to retain good teachers and to keep them there in the classrooms where they need to be. And we also need to be looking at higher education as well, too, that it's affordable for everybody and it's obtainable for everybody. And also to have a plan in a way to reduce or possibly eliminate student loan debt as well, too. So I want to see a president that's looking at all of these important healthcare and education issues in our children as we move forward, because 4 years is a long time to wait in between presidential candidates. So we need to make sure that we're voting and we're doing our best to make sure that our views are supported with our candidates.
Thank you so much, Dr. Pike. And then finally, to finish it off, Devin, what does a president for children look like to you? If you have anything to add.
Absolutely. So a president for kids understands that our nation is only as strong as our most vulnerable citizens, and those citizens are our children. A president for kids will fight to fully fund education, not threaten to defund. A president for kids will understand that regardless of their income, they need access to healthcare. A president for kids will understand that no kid should go hungry. No kid should go hungry in America. A president for kids will truly invest in dismantling the systemic barriers that exist within public education that prevent many kids from reaching their full potential. That's what a president for kids should look like, and that's how they should behave with that mindset. And so I hope that that person comes along very quickly. We are in red alert. We are in dire need of leadership, and perhaps until then, we should just look no further than ourselves. I think we're the leaders that we've been waiting for. Some of you youth that are on the call that are hosting us today, some of the panelists that have joined, taken time out of their busy day to join us here, we're the leaders that we're looking for. Now, I hope one day we do get a president that is truly for kids. But until then, let's lean on each other. Let's support each other. Let's uplift one another. If we see something that isn't right, we speak up and we act, right? We act. And so, and that's how we ought to move forward, is by focusing on just being better human beings.
Thank you so much. That was such a wonderful note to close on, Devin. And like Mara said, we have frontline workers among us. So thank you all so much for the contributions that you've made for your communities and for all truly being an advocate for children and for our future. And now quickly, since that was our last question of today, is there anything that anyone else would like to add before we close out, or any closing remarks?
I just feel so fortunate to be in this space, and just really very, very appreciative for the National Children's Campaign's work and for all of your work for the panelists here today. This makes me very optimistic.
Well, again, thank you all so much for joining me today and for talking about how we can reopen our schools safely when thinking about the safety and the health of children and teachers. So really, again, just thank you all for your service to your communities and for what you are doing every single day, especially to our frontline workers. So thank you for joining me today and for talking about this really important issue. It's been such an amazing experience. And it was amazing to hear your insight on schools reopening. So now just looking forward to the rest of the week. This week, along with the rest of our panels during Convention Week, is all streamed on the National Children Campaign's Facebook and YouTube. And if anyone is interested in getting involved with the National Children's Campaign, you can find us on Instagram or visit thenationalchildrenscampaign.org. Right now, we are currently working on our hashtag Vote for Our Future campaign in partnership with This Is 0 Hour, mobilizing voters in key swing states to get the vote out in November. Thank you again so much to our amazing panelists today, and I hope you guys all have a great rest of your day and rest of your week, and a safe a safe school year ahead of you. So thank you again for joining me today, and it's been amazing to get to know you all.